The neck is a three-dimensional structure. The shape of the neck is cylindrical. So this cylindrical shaped neck for anatomical purpose is divided into two parts. The part in front of this muscle beginning from sternum and clavicle, sternocleido, going to the mastoid process, sternocleidomastoid. So this oblique orientation of the muscle divides the quadrangular neck. How is it quadrangular? On one side, if you see in side profile or the lateral profile, it is quadrangular. So this quadrangular neck is divided by an obliquely oriented muscle. This obliquely oriented muscle, sternocleidomastoid, into two triangles. A triangle in front is called as anterior triangle. So it is anterior to the sternocleidomastoid. A triangle which is behind the sternocleidomastoid is called as posterior triangle of neck. So this is a posterior triangle and this is the anterior triangle. So in the anterior triangle, the base is upwards. The base is formed by the lower border of mandible, imaginary line from angle of mandible to mastoid process, and the anterior boundary is formed by the imaginary line drawn from the symphysis mentae till the suprasternal notch. So that is the anterior boundary. The posterior boundary is anterior border of sternocleidomastoid. So this is the anterior triangle of the neck. Whereas the posterior triangle of the neck, the anterior boundary is posterior border of sternocleidomastoid. The inferior boundary is the base formed by the middle one-third of the clavicle. Posterior boundary is anterior border of trapezius. One rhomboid shaped muscle is there. One Kajuberpi shaped muscle is there on the posterior aspect. It is called as trapezius. So that is the boundaries of the posterior triangle of the neck. So in triangle, basically we have two triangles, the anterior triangle and posterior triangle. In anterior triangle, mainly the submandibular gland, the carotid vessels, part of the parotid gland, thyroid gland in the midline, okay, infrahyoid group of muscles, all these contents will come in the anterior triangle. Whereas in the posterior triangle, the brachial plexus trying to enter the axilla or the armpit, so that will be there in the posterior triangle, along with a cutaneous branches to the neck, one running transversely, transverse cutaneous nerve of neck, one going upwards, greater auricular nerve supplying majority of auricle, other one going backwards and downwards, okay. The backward going one is lesser occipital nerve, the downward going one just above the clavicle is called supraclavicular nerve, which are three in number: medial, intermediate and lateral. Medial will be there in the medial one-third of clavicle, intermediate in the intermediate one-third, and lateral supraclavicular nerve supplies the skin of the chest up to the angle of Lewis or the